Hello, Dr. Dave Hindmarsh, and in this video we're going to talk about Med 3s or fit notes as they're classically called. And you'll see the symbol that I've got just to the left hand side of the screen, just showing you with regards to basically occupational health. Now, for me, occupational health is really interesting. I'm ex-military, so a lot of my workload was occupational health related. And it's worthwhile thinking about this in sort of two parts. It's about how your medical condition can affect you in the workplace, and likewise, the workplace can affect you even though you may be fit and healthy. The real easy way to think about this is, say, if you're on a busy A&E rota that you may be physically very well in yourself, but after that 4 months, due to all the night shifts, late starts, altering your sleep habits, that actually you are physically and mentally drained from this, and in some cases unable to handle the work. There's nothing wrong with you, but the occupational health or the environment that you're in has really adversely affected you. And as part of this, we need to realise that we need to be able to comfortably take an occupational health history for multiple reasons, but actually occupational health is a speciality in its own right. So you need to be aware of where to draw the line, because sometimes employers will go to you as the GP to be a bit cheeky and trying to sort of wheedle around this, whereas actually they need to engage with the occupational health employers. So think about this in basic terms, in terms of what is it that you do, and then actually be really nosy about it. So what does that job entail? You know, are you desk bound? Are you constantly driving around the country? Have you got any key responsibilities? And have you got any safety critical roles? And it's worthwhile thinking about with safety critical roles is like, if you can't do your job, if you'll become unwell, will someone else become hurt from it? Because sometimes, unfortunately, this goes wrong. And there's a horrible case of a bin lorry driver who unfortunately hid part of his cardiovascular problems from the GP. They'd signed their DVLA forms saying that they were fit to continue with their job, and unfortunately had another cardiac event behind the wheel of his lorry, and it subsequently killed several people in Glasgow. So we need to pay due diligence in terms of what we do and what information we sort of are asking for. So I'm going to think about this one. You're on the ward and someone's about to discharge a 70-year-old shelf stacker who's just had their hip replaced. Consultant in charge says, don't worry about it, GP can sort out the sick note. It's not their job, and that he can go home. So just pause. What are your initial thoughts? What do you expect the patient's going to struggle with this? So you probably come to along the conclusion that it's not quite right, that most surgical procedures have a rough recovery time, and it's not unreasonable to adjust this as the job required. In this case, he may need a bit longer as he's a shelf stacker, and so it's quite a physical job. So let's run through the fit notes, okay? So you've got the initial injury, and then you've got a week that the patient can self-certify. This is an interesting point that basically if they're asking for anything beyond this week, no. The answer is no. It's not covered under the NHS. If they're really insistent, then it's private work. Anything over a week needs a Med 3, so that's the official name through, or fit notes, sometimes called sick notes. Now, for that initial first week, there are two variations. There's an SC2 to be asked for, that the employer can then go on to statutory sick pay, and you must be off work due to sickness for more than 3 days in a row for this to be eligible. And it's an SC1 if you're unemployed or self-employed. And this is interesting BMA guidance in terms of who should issue the sick note. In short, whoever's done the procedure, so in this case the operation, is responsible to issue that fit note. So in this case, the Med 3 should have come from the orthopaedic surgeon. And it's fascinating. You speak to a patient, they would have been told how long they're going to need to recover, because they've got, say, a physiotherapy program that will last for, say, 6 to 8 weeks afterwards. So it's not unreasonable then for them to issue them a Med 3 for that period of time with adjustments. Something then we're going to discuss about, if a consultant consistently do that, how do we raise that? So just remember, these are not sick notes. They're classically called sick notes by doctors and Joe Public, but it's wrong, okay? The main thrust of that is that a sick note automatically defaults that you can't work, whereas actually with a bit of thought and a bit of a careful history taking, there is stuff that people can do. Okay, so don't always automatically go for not fit for work and just think, could they do something else? Another key point is only backdate this if you have medical evidence of sickness. And for me, I'm fairly lax with this, but as long as I've got a hospital discharge letter or something, so say they've been in A&E and it's difficult to get a Med 3, that they've got some evidence there, because effectively it's a statement that you're happy that they're off work for a particular reason. So we're going to talk about our someone who's working at the office, see a 40-year-old with really, really bad back pain, sat at a computer for 8 hours a day and gets horrendous lower back pain. There's no pain down the legs, no bladder bowel problems. She's already into her yoga and is working on her back with her private physiotherapist. Over the weekend on holiday, the pain will ease off completely, but as soon as she gets back to work, the pain comes back again. What are you going to do? Take a pause and just have a think. So with this goes back to our symbol about the occupational health. This is clearly the workplace environment now impacting on her. The history is deliberately giving you that implication that actually she's medically very well and extracted from that environment gets back to better. So in this case, it's quite simple. You just need to change the chair. And it's one of those that actually you can use the Med 3 and the comment section to push it back to the line manager to organise. Work is a duty of care to employees and additional harm caused by the environment. Every measure should be taken to provide adequate equipment to prevent harm. Because when you don't, they sue. So as I said, I'm ex-military, so even in that dangerous environment of being in the military, the Ministry of Defence still has an obligation to look after their individuals. And when they don't, there have been large-scale actions that the Ministry of Defence, unfortunately, depending on which side you're on, has had to pay out. And as I'm technically a veteran, I get banged in my Facebook feeds about hearing loss and industrial deafness claims. And also we'll get the odd bit about malaria. Have I been to a malaria country and have I had adequate protection? Both interesting cases in terms of large payouts have been made. So in this case, you see a 35-year-old who's a local pharmacist and she's feeling low and she's not able to cope. She's getting increasingly anxious and she's starting to doubt herself in terms of the decisions that she's making. Due to this, she's unable to sleep and feels exhausted. She feels a fraud at work and wants your help. Regardless of what you say, she continues to work. Is this okay? Again, just take a pause. So again, we're looking at sort of that occupational health bit. But this is a fitness to practice issue because patients are potentially at risk, okay? And think about this of yourself and have whenever you've been at work and not been 100% in the back of your mind. All professional bodies have obligations to basically get medical help when they're sick. You'll notice that if you're doing an appraisal or your annual review, that there will be a box saying, I've sought help when needed to. Nurses as NMC, doctors as GMC, pharmacist GPHC. Okay, main thrust is basically if you're sick, then you're not fit for work. Main issue then is if you make a mistake that you're sick, it puts you from a professional point of view in a real difficult situation. And I take this with a huge pinch of salt, but I'm very cynical when it comes to this. The NHS and is run on a lot of goodwill, and a lot of people will go into work when they are perhaps not 100%. And each of you will have your own different level. There'll often be pushback because obviously you not being there will cause a gap in the rota. But from my point of view is gaps in the rota aren't your problem, okay? If you're making a mistake and you shouldn't be there because you're ill, then that will be your problem. Your professional registration is your most prized asset, okay? You can earn good money wherever it may be because you are a medical professional. For heaven's sake, please just look after it. But I'm all better now. Okay, 22-year-old has come for a fit to return note following a period off with a cold. This lasted for 4 days and they now feel physically well. They didn't seek any medical advice from either A&E or from the practice, but he's requesting a letter. What are your thoughts? Again, take a pause. You can't. Well, okay, technically you can, but it's your judgment. You've got no evidence either way. So that's your first bit. You don't know he was off with a cold. You don't know why he was off work because you've got no medical evidence to support that. So you're putting yourself at risk if he, say, lied and you've got a letter saying that, yes, he was off with a cold. If he's insisting, it's private work. It's not covered under any of the obligations of the practice. It's well within the SC, so it's self-certification time period. If they're really insisting they want something with your signature on it, charge for the time. Nice, short, sweet overview of the sick notes or Med 3s. Just remember key take-home points. Bit about occupational health, making sure that you take a good occupational health history, that you know about the difference between SC1 and SC2 and the time periods, and that if it's outside of that window, that you're giving an appropriate Med 3, thinking about whether they can do anything at work, and likewise, think about if you're getting any pushback or any requests from elsewhere of actually, could that clinician do it, and what are your mechanisms to feed that back. Dr. Dave Hindmarsh, GP Templates. Thank you very much.